What are my patient rights, and how do I advocate for them? Imagine walking into a doctor's office and knowing exactly what you're entitled to as a patient. That confidence comes from understanding your patient rights and how to stand up for them. Everyone deserves respectful, fair, and accessible health care, especially if you have a disability. Knowing your rights helps you get the care you need without unnecessary barriers. Patients, including those with disabilities, have specific rights designed to make sure they are treated with dignity and fairness. One key right is the right to non-discrimination. Laws like the Americans with Disabilities Act and the Rehabilitation Act say you cannot be denied services or treated unfairly just because of your disability. Your health care provider must give you the same quality of care as anyone else. Another important right is to reasonable accommodations. This means your provider should make changes to policies or facilities to meet your needs. For example, if you use a wheelchair, they should have accessible exam rooms. If you communicate using sign language, they should provide interpreters. If you need materials in large print or electronic formats, they should supply those too. These accommodations should be made unless they cause an undue burden, which is a rare exception. You also have the right to be involved in your care decisions. This includes understanding your treatment options, asking questions, and refusing treatments if you choose. Your provider must give you clear, easy-to-understand information about your health and options. You should be able to decide where and how you want to receive care, whether in a hospital, clinic, or community health center. Your privacy is protected too. Your medical information must stay confidential and only be shared with people you trust or who are involved in your care. You have the right to have your personal health details kept safe. Respectful treatment is another key right. No one should be abused, neglected, or treated disrespectfully during care. You deserve to be treated with kindness and dignity at all times. You can also bring a support person with you to appointments. This could be a family member, friend, or caregiver. They can help communicate your needs and support your decisions. Now, how do you make sure your rights are respected? First, learn what your rights are under federal and state laws. Knowing this is the first step in advocating for yourself. When you see your provider, tell them about your disability and specific needs early on. Don't hesitate to ask for the accommodations you're requiring. Be clear and direct about what you need, whether it's an interpreter or accessible equipment. Bringing someone you trust to appointments can help you communicate better and remember important details. If you have trouble understanding information, ask for it in formats that work best for you, like large print or electronic text. If your rights are ignored or you don't get the accommodations you asked for, you can file a complaint. This can be done with the health care facility, state agencies, or federal offices like the Department of Justice. You can also seek help from disability rights organizations or legal advocates. They can guide you through the process and support you if your rights are violated. Keep records of your communications, requests, and any incidents where your rights were not respected. Having this documentation can be very helpful if you need to take further action. Remember, advocating for your rights is about making sure you get the care you deserve. By understanding what you are entitled to and speaking up for yourself, you help create a health care experience that respects your dignity, autonomy, and health needs.